everybody. Welcome to Nurse Deck. We are doing an interview series, and today I am with Dr. Rayne Soriano. I'm saying that right, am I?
You are.
Okay, good. Great name.
Thank you.
As you know, Nurse Deck is a nurse-led community website where we support nurses in all stages of their journey, whether it's nursing school, through decades of experience, through resources, guides, camaraderie, humor. We're launching a new platform now, which is a social Nurse Deck, and it's got us all very excited. We've had a lot of great feedback on it so far, so stay tuned for more there in that space. But my guest today, Dr. Rayne Soriano, you are in beautiful Hawaii.
Yes, aloha.
Yes, aloha. And Dr. Soriano is a doctoral prepared healthcare leader and educator. Your expertise and background covers so many things, but clinical operations, nursing informatics. I saw some EMR design and rollouts. Bless you for that. Taking on that. You're also a visiting and adjunct professor at the University of San Francisco, Chamberlain University.
Yes.
And currently you are the regional director for operations and nursing professional practice with Kaiser in Hawaii. Is that right?
That is correct, Brianna.
All right, great. Well, I'm very excited. We're going to do a lot of questions about nursing leadership.
You got it.
How to motivate teams. I think as nurses, we don't get a lot of training with that, especially for our nursing students that are out there. So the more conversations we have about that, I think the better for people.
Definitely.
We always like to ask how you got started on your journey. Now you're a regional director of operations. How did you get started on your nursing path?
You know, it's funny. Nursing, I must say, nursing wasn't in my initial career path, growing up. In fact, I wanted to be a pediatrician because, being the eldest of 5 boys in my family, you kind of grew up taking care of your younger brothers, whether that's rescuing them with Heimlich maneuvers or, carrying them home from a fall or, an accident at school or something, so growing up and caring for your siblings and being the responsible one, you sort of fall into it. And interestingly enough, as I was, thinking about career paths, my junior year, I would say senior year in high school, my mom told me a story about, if I wasn't so busy raising 5 boys, my dream would have been to go into nursing. And that sort of planted a seed in my head, to be honest, Brianna. And I said, wow, nursing, I never considered it. And so in looking into it, man, it's like, you get to spend more time with patients. It was certainly less school, and at the time, it's like, gosh, I didn't really want to spend too much more, time at school at that point. And so if I could finish something and then go from there, that was very attractive. And I think, even at the time, this was in the mid to late 90s. Men in nursing, there wasn't a lot. I mean, I only had 6 men in my class, my whole nursing school, in my class at least. And so it was still an emerging population. And so, it really, helped in terms of, breaking into not only the profession, but being in a place where, again, growing up, you're already caring for your siblings. Now I can actually get paid for it.
Yeah, right.
and so it just felt natural, and I've been blessed ever since, Brianna.
that definitely tracks. I can relate. A lot of similarities there.
Yeah. So interestingly enough, my first foray into the career was in emergency nursing, and so that's my background. And what I like to tell people is, specialty wise nowadays, and learning more and more about the different specialties, there's the experience side of it and the clinicalness of it. But, honestly, a lot of it too is what matches your style, your personality. So for me, I always tell people the emergency department matched my personality and my work style, because I'm kind of all over the place.
Right.
Again, raising five, siblings, you're ready for anything.
Yep.
You have to triage, what's the most important thing,
Right.
here. And so that again, it felt very natural being in that setting. And if you can think on your toes, you don't
Yep.
mind, hard work, because oftentimes what I tell people who want to come into the emergency department, your hardest shifts are often your best shifts, because that's when you really come together as a team and
Yeah,
figure it
exactly.
out, right? And so
Mhm.
yeah, so I spent 11, almost 12 years in the emergency department, in various roles, from frontline ED nurse to educator and management, and really fell in love with the educational pieces of it.
Mm.
And so, interestingly enough, Brianna, one day, while teaching a class, I think it was a charge nurse class or an ACLS class, somebody said, gosh, you would be crazy enough to lead the implementation of this electronic health record in 21 hospitals. And when people, want crazy and want, daring, I guess they come to the emergency department. And,
Yeah.
I always tell people, my adventure nursing is fascinating, because I find myself being at the right place at the right time, if
Ah,
that's what want to call it. And so,
yeah.
I had the opportunity to help co-lead the EPIC implementation in 21
Whew.
hospitals,
Oh,
starting in 2006.
wow.
And
Wow.
it was going so well. Of course, the reward for good work often is more work, and so it's like, hey, let's go twice as fast,
Yeah.
now that we've gotten on a roll. And so,
Yeah.
and I think that's when my career, Brianna, went from what was emergency nursing into what we now call nursing informatics, because
Mhm.
initially it was sort of like, well, it's just going from paper to the computer. But then you start realizing it's like, wow, this is a lot of data we're putting into the
Mhm.
system. What
Mhm.
can we do as far as outcomes,
Yeah.
quality, safety? I mean, look at what Amazon, Google,
Mhm.
Facebook, now called Meta, is doing with data and
Yep.
information, right? What if we could do that in healthcare, and
Mhm.
turn our data into good, right? And
Right.
predicting, falls or injuries or things like that. So that was,
Right.
exciting for me. And I think that's what really brought my career, academic career. I kept wanting to go back to school to keep sharpening, my tools as far as being an educator. I love teaching. I love, I was a new grad in the emergency department. So my whole
Mm.
career has been all about how do you pay it forward, pay it
Mhm.
back to the profession that's taken care of me and
Yeah.
has blessed me with a lot of things, Brianna. And so,
Yeah.
so I kept going back to school. I got my master's in education, and then I had the privilege of attending UC Davis as part of the second cohort of their PhD program.
Mm.
And it was a dual track of nursing research and leadership. And
Ah.
so, I got to hone, a lot more of my skills in terms of research, teaching,
Mhm.
leadership in that program. And so, nowadays there's so many schools and programs, Brianna, that, unless you have a purpose or a goal in mind,
Mhm.
the question is, do I really want to go back to more school just to get the initials behind my name? Or what am
Yeah.
I actually going to do with it, right? Well, how am
Right.
I going to continue to make a difference and put
Mhm.
myself in positions and at the table?
Yep.
And so, yeah, so it's my career's evolved, so from informatics, somebody said, again, being at the right place at the right time, hey,
Mhm.
Sorry,
didn't
I
you,
couldn't hear
oops,
what you said.
there's my talk about technology.
Yeah, right.
And
Really
so,
must
it's
have.
like, yeah, thanks, Siri.
Yeah.
And talk about, being at the right place at the right time. I was at a conference, and I met our regional director of quality at the time in Northern California. She said, Rayne, let's go have lunch when you get back to
Mhm.
Northern California. And it's never just lunch. And so we talked about this new program, Medicare Operations program, Brianna, where really the goal was to serve our elderly and growing
Mhm.
elderly population,
Mhm.
as in regards to why do they keep coming to the emergency departments as
Mhm.
their option,
Mhm.
and get stuck there,
Sure.
and so so I started working on that program and really got the honor of launching what we now call our Medicare Operations program, and that sort of tailed into what we started doing with homelessness in the emergency department and really vulnerable populations. And so I came back full circle into the emergency department, but this time in a different lens to help our social workers, our case managers, our physicians really figure out how to put together care plans for our most complex and vulnerable patients. And it was a man, talk about learning the connections in healthcare, and so and the importance of multidisciplinary care, working together. It's not just about nursing, it's about everyone in that care team, including the family and the community. And so just so blessed to learn from various specialties, Brianna. And then
I couldn't hear what you said.
I gotta put this watch away. It's like thinks I'm talking to it. And so from there on, one day I said, we need to put together better training and education programs for case managers and social workers with this growing population of complex patients that we're seeing. And so I went back to my roots in nursing program, and I said, hey, here's what I want to do. I want to put together these training programs, hopefully new grads, and expose people who want to come into the outpatient and continuum spaces, not just hospital programs, but really wherever nurses are in the community. And so my nurse leaders at the time said, well, Rayne, I'll do you one better. Why don't you just come back to nursing full time and start, doing new grad programs and, all this specialty training programs for everybody. And of course, Brianna, like I said, my passion was education. So it was a dream come true to do that. And so, I did that for about almost 3 years in Northern California, taking care of 21 hospitals, over 24,000 nurses in terms of development, education. And then this opportunity in Hawaii came up, and they said, Rayne, that's awesome, that you're doing that work, but in Hawaii we have these unique challenges in terms of we have nursing programs, but no programs to really hire and train people, and so people were leaving for the mainland in hopes that they would come back, after getting their experience, right, Brianna? And so that wasn't the case, unfortunately. And so, coming here, between the adventure of moving to the islands and, really just working with such passionate, committed, experts and individuals here, and then working with our Hawaii Center of Nursing, Council for Nursing, and, with all of the other hospitals in regards to building, development programs, whether it's new grad programs, new to specialty programs like critical care, peri-op, and just building those programs here in Hawaii has been such a glorious adventure. And so that's where I am today. And, again, just my adventure in nursing has been nothing short of just meeting a lot of great people and mentors along the way. Well,
I can definitely feel your passion for it coming through 100%, which is great. We need people like you being the face for new grads coming in, because I think sometimes nurses hear informatics and anything to do with rollouts of any kind.
That's right.
When I started in nursing, it was around the time that medical records were all going electronic, and there was a great divide of new staff versus old staff that were just like, not going to do it,
Right.
So it's interesting to hear how your take on informatics coming back around and harnessing that data to create nursing-led initiatives, and then bringing new grads into it.
That's right.
It all works. I love it.
And I just read a cool article, Brianna, on the Generation Z, in terms of the workforce, right? And so we always talk about there's the two groups. There are technology immigrants and there are technology natives. And so when rolling out, to your point, anything, whether it's an EHR or, we're going digital, we're using predictive scores and analytics nowadays. And so it's sort of like, wow, for those who are experienced and have been in the field, who are technology technology immigrants, it's freaking them out. It's like,
Mhm.
oh, I don't
Threatening.
want to, I don't
Yeah.
want to hurt anyone by
Right.
misusing or not seeing something that I was supposed to. But then we have this new generation of, technology natives, where they were
Mhm.
practically born with a smartphone in their hand. So the features, functionality, that's
Right.
not the problem. It's the
Yeah.
critical thinking and the
Yeah.
patient care and engagement, right? it's
Yeah.
it's what we used to call
Right.
bedside manner,
Right.
and how to talk to people versus,
Mhm.
nowadays everyone's, so neat, deep in their
Right.
phone
I'll
that
text
even.
you. Yeah.
Yes, yes. You see people at dinner, or in their dates, and they're just like, in their phones, and it's sort of like,
Mhm.
well, we used to always also say, don't treat the computer, treat the patient,
Yeah.
and actually be with the patient. And so
Mhm.
that's I think the challenge in terms of technology. It's, there's an aspect of it that's moving us away from the bedside, because we
Yeah.
have to, enter so many passwords, scan a lot of things,
Right.
organize and check a lot of boxes in the systems. And so I think, the beauty about nursing informatics is we have a chance to really bring back the heart in the technology,
Yeah.
plug into the matrix, so to say, as
Yeah.
nurses, and really, continue to provide that personalized care,
Right.
and show that we're still focused on the patient, on,
Mhm.
whether that's birth to death, right? It's just the honor of nursing, because
Yeah.
we're there during those times and not in front of a phone or trying to figure out a password or something. And so I think the
Mhm.
usability aspects, to your point, Brianna, are huge in
Yeah.
terms of informatics. So yeah.
Absolutely. I couldn't agree more. You touched on some of the nursing programs for new grads. I'm curious a
Hmm.
little bit about the Kaiser Permanente nurse residency program.
Yeah.
Can you talk a little bit about that?
Sure, sure. And one of the things with the residency program, again, going from Northern California, where we had 21 hospitals, and so trying to coordinate, 21 hospitals, work with, in Northern California, we were working with Vizient, our
Mm,
vendor for
mhm.
the nurse residency program. And jumping on a magnet journey, you want to have evidence-based curriculum, and really a program that's organized with feedback loops along the way. And here in Hawaii, we're working with our health stream partners, because we were fortunate to work with the Council of Nursing through a
Mhm.
grant, where we can again apply that evidence-based curriculum. It's 12 months of med surg telemetry,
Yeah.
but throughout the way, it's I think, a big part for us, and especially now that we're coming off, hopefully, knock on wood, the last surge of this pandemic, it's how do we sustain and re-energize our
Yeah.
preceptors, and I
Yeah.
think that's been a big aha, and I think a big opportunity for us, Brianna, because it's tough, even with the opportunities to bring in more and more new grads, if they have preceptors who are, we talk about this great resignation
Yeah.
or great retirement,
Yeah.
and it's like, if people are just like, I'm done,
Fun. Yeah.
I'm out of here, that's not the experience you want, new grads
Right.
to come into. And in some aspects, there's this balance of, and I think our roles as leaders of really striking that balance of taking care of your preceptors, re-energizing them, and then as you start doing more training and education, reinvigorating the hope for the future, that it's not just me, I'm not the one that's going to have to be here working,
Right.
all these shifts. I'm, taking care of the future. So
Yeah.
this is the cavalry that's
Right.
coming
Right. We
in,
need the fresh
and
wave. Yeah.
yes,
Yeah.
totally, and bringing some pride back into the
Yeah.
profession and the practice. It's the heart of precepting. It's the heart of mentorship, and really paying it forward, and it's
Mhm.
like how, I always laugh, because it's like, gosh, you guys, we got to make sure the new grads do a great job, because we're going to be their patients. And so it's sort of like, wow, yeah, we want them to be
Right.
safe and
Yeah.
caring, because we might be on that gurney or that bed at one
Yeah.
point here in the future. And so
Right.
that's sort of the frame that we're going by. I
Yeah.
mean, just thinking about how we would want to be treated, and
Yeah.
paying that forward. And so it's not about how well you start IVs or how great you are at technology, again, as much as how caring and
Hmm.
compassionate, and just as a working as a team member, and
Yes.
just caring for each other, and I think that's
Yeah.
what's going to get us through. And so, with these residency programs, it's the curriculum, the 12 months of seminar. Another big part too, Brianna, that we're challenged with is, simulation, high fidelity
Yeah.
simulation. I
Yeah.
think one of the ahas that we learned, even with the new grads coming out this last, couple of batches, is, as we've had to pause, if not cancel, a lot of clinical
Right.
rotations
Yep.
during COVID. And so what we're finding is that, residents coming into the profession now, we're almost finishing their senior year of
Yep.
nursing school
Hmm.
versus really starting them in that transition to practice, because
Yeah.
they've had a couple days in clinicals,
Right.
you know what I mean, in their senior year, and that's not a
Where who
lot.
knows what they saw,
Yes, yes,
Yeah.
or if it's just a simulation, right?
Yeah.
Or so that's what I think we're sort of playing catch up in a way. And so how
Yeah.
do we adjust these programs to, build that confidence, get
Yeah.
them back at the bedside? And so in some cases, for those who graduated maybe a couple years ago or close to that, we're
Hmm.
pairing them up with a hospital aide or a unit clerk, just to get back into the hospital
Yeah.
groove, into the flow of things
Yeah.
before, getting them in at the bedside. And so, I think it's important to make those adjustments
Yeah.
in these programs as well. But yeah, it's letting go of a lot of old traditions as well. We used to say, you have to have at least X number of years before
Right.
you can go into critical care or
Yep.
peri-op. And again, with the generations and the way people are learning nowadays,
Hmm.
it's so accelerated that the
It is
challenge for us,
accelerated.
right,
Yeah.
yeah, is to build programs that match the learner, that are still safe and
Yes.
accredited. But then how do you get people into, again, the right place based on their style, their
Right.
mode, the way they are, back to how I found I fit into the ED. It's sort of like, wow, there's some people who love and would fit into critical
Right.
care who do really
Yeah.
well, versus peri-op. In fact, we've had a couple of our knee grads in the OR go, I didn't realize everyone was going to be sleeping. I
Yeah.
love patient interaction, and they are
Uh-huh.
zonked.
Yep. Right.
They're under.
Doing a lot of counting down from 10, but
Right.
yeah.
Exactly. That's about the interaction you
Yeah.
have, with them. And
Right.
it's like, yeah. And so, and so what that taught us was, gosh, can we have sort of a more of a shadowing, maybe get to know the specialty program before they
Yeah.
go all in, right?
Right.
And maybe so people can have a better choice and eyes wide
Exactly.
open. Okay, I
Yep.
love that specialty. I want to go into mother baby or
Yep.
perinatal, or so yeah.
Right.
So a lot of ahas.
Yeah, absolutely. It's like a Rubik's cube,
It
of
is.
matching up so many parts of the personality, like you said. And I love what you said is you got to go beyond the bedside skills. I mean, those will
That's
come
right.
in time,
That's
but
right.
really inspiring and motivating new nurses to kind of plug into the current of nursing, that it's below the surface. You don't know that it's there until you're part of it.
Yeah,
But that's what will sustain new nurses, I think, when they feel
that's
that
right.
energy.
That's right.
So I think those
And there,
programs are a great way to do
yeah,
that.
and there's a whole thing about, again, in terms of preceptor sustainability, Brianna, it's sort of like, as we start doing more residency, programs, it's building an alumni network even
Yeah.
within the organization. Because, to, have a mentor, again, a buddy, we talk about the attrition, right? The turnover
Yeah.
within 2 years of starting your nursing career. Well, let's say you had a big brother, big sister, through that two
Right.
years, through someone that just went through the program and can tell you about how they adjusted to night shift,
Hmm.
or how they got through that,
Absolutely.
really tough charge nurse, right?
Yeah.
Or
Right.
how they overcame, their first death, and I mean, it's just
Right.
a lot of things that I think we can build in terms of
Yeah.
mentorship, support. And so,
Mhm.
yeah, just I think just thinking out of the box and meeting people where they are is
Mhm.
really important in developing these programs.
Absolutely. I
Yeah.
100% support that. That's awesome. Tell me, as a leader, when you are trying to motivate your team, especially in pandemic times, what how do you do that? How do you keep them motivated? How do you keep yourself motivated? When
Yeah.
we're on like what now, the eighth wave, whatever region you're in, you know?
Yeah, that's
Um,
the thing about being in Hawaii, a lot of waves.
yeah,
Certainly a lot of waves.
yeah,
Yeah, that's a great question. And, I think, between talking about the importance of resilience, through these challenging times, and really, I think what we've seen, Brianna, is the moral distress and what that really
yeah.
means. There's a lot written about it, but to be a nurse, and your role is to facilitate that family-centered care and bring them in. But now you're in a position of saying, sorry, one visitor at a time, or you
Mhm.
can't be here when your
Yeah,
family members having a baby, or
right.
they're in their last breaths of life. Sorry, we can
Yeah.
only allow one. And in fact, we personally, my father passed away in the first wave
Oh,
of
I'm
COVID,
sorry.
not of COVID, thank goodness, but
But
couldn't we
yeah,
couldn't be at his bedside. We're a
right.
big
Oh,
family, as I mentioned. But
yeah.
and so seeing the
Gotta be
guilt and
great.
the challenge of the nurse and the caregivers to tell us we couldn't be there, during
Right.
his last, breaths,
Yeah,
it was a struggle. And that's, so feeling
right.
in reality what moral distress is,
Yeah.
and what our nurses must be going through,
Mhm.
and being now the barrier to that
Right.
family,
Yeah.
connection, right? And so I think the first step, Brianna, is just realizing what the truth is behind
Yeah.
what when we talk about moral distress and
Mhm.
burnout,
Yeah.
and why people are wanting to leave the profession, and getting to the root cause of that.
Right.
And often what I've found in terms of my own team is it's one-on-one conversations. So,
Mhm.
I'm looking at my calendar, and as a leader, I'm canceling meetings left and right and replacing them with just check-ins. Hey,
Yeah.
let's do a walking meeting. Let's go take a walk. Let's go meet out and have
Yeah.
coffee and just talk about, and not even about work or data or
Right.
our measures or the Joint Commission surveys, but how's it going?
Right.
Just keep it simple. I think,
Yeah.
our minds, our hearts, our emotions are so overfilled and tapped
Yes.
out that let's just keep it simple and
Yes.
make that be okay. And
Right.
I think if we can get back to our baseline square one, hey, how are you doing? Are you okay? Do you need time off? When was the last time you took
Right.
time off? And so I think as leaders, the challenge for us is to, again, and that's why new grad programs and these programs are so huge, because you're
Mhm.
building the cavalry, in
Yes.
case any of this happens again, and that, you have enough of a community of support. You have
Yeah.
people you can tap into. Hey, Mary's been working 12 days straight. Who else can, cover,
Right.
and that's really for me as a leader, the challenge in terms of getting to know what people need in a
Right.
one-on-one sort of conversation. And a lot of times it's to vent, to talk about, and talk
Sure.
about moral distress. Brianna, now we're looking at who's vaccinated, who's not, who
Mhm.
has an exemption, who doesn't. So you've gone through 3 waves of COVID, where we're
Mhm.
all together, we're all fighting this together. And
Mhm.
then this last wave, it's like, who's vaccinated, who's
Yeah.
not. and
Right.
and patients that are coming in who aren't vaccinated, we've even noticed,
Mhm.
a level of anger and
Right.
frustration from the
Yeah.
caregiver perspective, right? It's like,
Sure.
wow, how can you not, you've seen
Absorb it.
young people passing
Right.
away, and it's like, how do you not? But then on the other end, it's like respecting choices. And so it's that moral conflict, that moral distress and dilemma that we
Yeah.
face. And so having venues as leaders to talk about it, whether it's one-on-one, addressing it,
Yeah.
that it's okay to vent, to cry,
Right.
to just to share, to have time to
Yeah.
yourself, and make those spaces available,
Yeah.
and just keep it simple. I think, because
Mhm.
we're so tapped out with the changing rules on PPE and
Right.
ventilation and drugs, and
Right.
to manage this pandemic, that it's like, gosh, can we just say, how's it going? How are the
Yeah.
kids?
Right.
When was the last time you took a day off? Hey, you want to go for a walk? And
Yeah.
just keep it simple and start from there,
Right.
Brianna.
Well, I think you answered one of my next questions, which is I'm just going to circle back to it, or jump ahead, I guess, rather. about the importance of community, like you said, the one-on-one check-ins, and helping nurses with their mental health specifically. Like you said, it goes way beyond burnout. I mean, we have nurses that are dealing with PTSD symptoms, and that's going to be going on now for, I'm sure, for years. We're going to be dealing with the aftermath and the mental health aspects of it. So I think it sounds like you're nurturing a community where you work, that nurses feel okay to speak, plainly and be vulnerable, and have other people mirror back to them that they're feeling those feelings too.
That's right.
Is there anything else you want to say about the community aspect when it comes to nurses and mental health? We're big on that at Nurse Tech, obviously. Us being a virtual community, I think even if you don't have that person to take a lap with at lunch,
that's right.
Trying to step in and just, if you need to get on your phone and send out
you can take them with you.
Text. Yeah, exactly. You're in the bathroom, wherever. But I think it's so important, and I'm glad that you already jumped ahead to that, because it's such a big issue for us to talk about.
It's huge, Rayne. And I think mental health, even before the pandemic, I think as an organization, as a community, we were so focused on mental health, between suicide prevention, depression, mitigating depression, through all the continuum of life, from, whether it's postpartum depression all the way to end of life, and, the depression and, the grief periods. And so I think, what I go back to is, gosh, you think about all those lessons in nursing school, whether it's the curves, the grieving curves, or the novice to expert, and a lot of the things that now it's like, that's what that means. And so as an educator, as someone who works with a lot of new grads and even our own educators, it's making those connections that here's the why of why we learn these theories and these lessons and these models. It's because it's been and we talk a lot about evidence-based practice and evidence-informed practice anyway, and so that these are the connections as to how we pay it forward, and making those connections so that we know what to do when we assess and see that, oh my God, this person might be getting burnt out, or they're grieving right now. What do we do in that case? And is this the right time to do an evaluation, or or give constructive feedback? And it's that emotional intelligence that we have to bring in as well, right? And it's and it's all of that. And so all of these things that become sort of words that get thrown out there, social determinants of health, and a moral distress. I mean, a lot of studies, a lot of things are being written and studied about it, but when it comes down to the experience and what to do about it, Brianna, it's very much an intimate one-on-one, because people aren't just going through one thing. Oftentimes, as you know, they're going through a lot of things with some water under the bridge and implications for future. And so when we talk about things like suicide, prevention, my really young cousin, in fact, right before the pandemic, committed suicide. And we, again, the tragedy of seeing a bright future just end, and not knowing what could have led to that, and what, we could have done, and the guilt and how it affects others, moving forward. And just people, like, even in entertainment, or, you think, wow, I'd love to be the lead singer of Linkin Park, but then, you see videos of him with his kids, and the next thing you know, he's killed himself, and it's like, wow, and so you just, that picture of the iceberg, Brianna, where you see the tip, but then it's everything that's happening underneath, right? And so to me, that's been the symbol of mental health for I think us as colleagues, as workers, as well as the patients and our own families as well. So
I think the only safe assumption we can all make about our coworkers is that there's way more going on below that. How's it going? Fine.
That's exactly it. That's exactly
Tell me how you're
it.
doing it, because it's not fine for me. Yeah.
Yeah. And so
No,
we you know, as leaders, we talk about our rounding, right? So as nurses, we do rounds. As leaders, we talk about purposeful rounding, and I think,
mm,
that really has to be top of mind as we come out of this, pandemic and with everything, because the mental health challenges we were, trying to address
right,
before the pandemic has not only just evolved, but it's now, taken
right.
on exponential
Sure.
meaning, I think, because now you can't even separate work from home, because
Right.
a lot of us have had to be home to be
Right.
teachers, and
Right.
it's like there's no safe space anymore.
Right.
So I
Yep.
used to commute, Brianna, from Sacramento to Oakland almost every day, and people said, "Wow, are you crazy?" It's like,
Right.
"What are you doing?" But to me, that was my me time. That
Yeah.
was my time of just
Yeah.
breathing. I was in the slow lane for the most part, and just trying to breathe
Yeah.
and build that resilience before the next thing, because we don't have breaks anymore. Things
Right.
bleed into each other, days bleed
Right.
into each other. I mean, it's
Yeah.
Halloween this weekend, so it's
Yeah.
like the year's almost over again. So
No, it's so
yeah,
true. You don't have those. I mean, even when you get in the car, you throw on a podcast and
that's it.
um, which I mean, I realize the irony of making one now and saying that, but I think you don't have time to be alone with your own thoughts and
That's
just
it.
reflect and absorb the weight that you're under.
That's right. And as
Um,
as leaders, that's it. As you do these rounds and the one-on-ones, it's how do you decompress yourself? You're gonna
yeah,
hear a lot of painful experiences, a lot of, concerning things, that as a leader and as someone who wants to just support your staff and your team, it's like, gosh, what do I do? And it's, as an emergency department nurse, I want to cure this and fix this
right,
now, and it's like we have to do something. And
yeah,
that's not always the case, because
right,
a lot of this has happened
so
through
true.
time,
Yeah,
and so it's not an overnight flip of the switch, unfortunately.
yeah,
So yeah,
yeah. I mean, I think you bring up a great point that even though we're faced with these huge problems, the mental health burden, the response and the answer to it, the most effective is, like you said, the simplistic, just, hey, how's it going? Like, no, I really want to know.
yeah,
We don't
start
need these
there.
big measures to combat it. We
That's
need
right.
these small
That's right.
interpersonal moments to
That's right. And
help combat.
it's got to be genuine
Yeah,
too, it can't be because, oh, we have measures and care experience and all these measures,
right.
hanging on the asking these questions. And people see that and people
Yeah,
feel that,
yeah, they
and
do.
it's like when you're doing it to, just to do it, it comes off that way,
Yeah,
and you'll get the
absolutely.
answers that
Right.
you get because of
Yeah,
that. So
absolutely.
like you said,
Well,
I'm fine. I'm good.
yeah, right.
I don't need
You'll,
anything. It's like, okay,
yeah,
check,
right,
what
exactly.
do you do?
Done my due diligence for the day.
That's
Check
right.
you
That's right.
tomorrow.
Yeah, did my
Yeah,
rounding. Yeah, totally.
yeah. No, it definitely, we need to get below the layers that we are, the masks that we
That's
all put
right.
on. I want to switch gears a little bit.
Sure.
Talk about nursing innovation, because I know you do a lot with technology. And what innovations are you looking forward to, wanting to see more of, wanting to see less of? We
Yeah, no,
touched on this a little bit, but talk
and
more about that.
I have to give props to I call my brother from another mother, Dan Weber, Dr. Dan, as we know him in social media, and he's to me the forefront in terms of innovation, and especially in nursing innovation.
Yeah,
And so a lot of colleagues really thinking, far ahead in terms of what we need. And so again, when we think about the nursing process and doing our assessments, it's like, where are we today? And again, before COVID, a lot of our innovation stemmed around things like, oh, what can we do with 3D printing? What can we do with, digital health and wearable technologies and a lot of these things.
hmm,
But I think, again, pivoting now to how do we make things easier? How do we make technology more
right.
seamless and easier? So knowing that we're in an environment where people are either burnt out, coming
Yeah,
out of burnout, or really close to burnout,
hmm,
let's not let technology be that straw that
right,
gets them
right.
there.
Yeah,
It's like,
right.
I don't want to see resignation or retirement papers because we've just introduced so much technology that, I mean, I'm struggling to remember my own passwords for banking and my
Right.
personal life,
It's
much
so
less,
true though.
more,
That can be
right?
what pushes you right over the edge.
Yes,
Yeah.
yes, yes. And one of the best innovations at the time was when, our Pyxis or medication machines, came up with
Yeah.
biometrics. So you can now use your thumb instead of
Yeah.
me holding, medications,
Absolutely.
trying to put in passwords. It's like,
Hmm.
biometrics, and how we can make things again easier
Right.
for our nurses. We see a lot of innovations in the medical field when it comes to supporting our physicians, whether that's using
Hmm.
dictation to document their notes.
Right.
Again, how do we honor people's time? So, going back to what we were talking about earlier, Brianna, it's like, how do I keep my eye and my heart with my patient, but then technology is running in the background to
Yeah.
support us,
Right.
so give me the right information at the right
Hmm.
time for the right patient and
Yeah.
help me do the right thing. And
Yeah.
then, when in our big, and speaking of education, a huge role for us is still patient education. And so again, when you look at our
Hmm.
patient populations, whether that's our most vulnerable populations or with the Gen Z and younger generations in the workforce
Hmm.
today, how do we match up,
Yeah.
teaching using things like, I mean, YouTube, people learn with 5-minute videos nowadays. They don't
Right.
need 100-slide PowerPoint or a
Right.
big, thick, physiology book. It's like, oh,
Yeah.
I got the video, I got it, I
Right.
saw it.
That's so true.
It's all I need to do. All I need to do.
Hmm.
I mean, look at IKEA furniture. They don't.
Right.
They
Yeah.
it comes with a
Yeah.
little bubble man, and it's like, oh, I got it. So it's again, the innovations I look forward to are how do we again make it mentally easier to get the right
Right.
information at the right time. Looking at how we're doing it in our consumer lives, whether it's
Hmm.
not no longer having instruction manuals, and
Hmm.
then how people are learning to use stuff because there's
Yeah.
so much in our environments, whether it's technology, it's equipment that are high risk, but we rarely use it. So how do you keep it
Right.
fresh in your mind?
Sure.
And
Yep.
so, it's those types of areas that I hope we can, apply to nursing more. And
Yeah.
again, while I'm doing my assessment, talking to my patient, let me dictate it so it goes into the EHR in
Right.
the right place.
Yeah.
One of my mentors, Marilyn Chow, we worked together a long time ago in Kaiser, and she's since retired, but still we stay connected. We always talked about, gosh, wouldn't it be great if there was a Siri or an Alexa for
Yeah.
nursing?
Right.
Because when we did a time and motion study, Brianna, a long time ago in studying nursing activities, it's like we spend so much time looking for stuff,
Yep.
whether it's actual physical things
Right.
or information.
Right.
But nowadays it's like, Siri, I'd like to
Right.
find the closest gas station
Right.
from where I am. Wow, wouldn't it be great if I could do that with a bag,
Right.
saline bag, or
Right. Yeah.
it's like, find me the next charge
Calculate the
pump.
strip. Yeah.
Yeah,
Right.
yeah, you know what
Yeah.
I
I
mean?
mean,
And so
it's so true.
those are the innovations I really look forward to,
Yeah.
because again, technology is there to support us and
Right.
not add more stuff, and I
Unburden
think
us rather than add to the weight.
totally, Brianna, because
Yeah.
when you have systems designed for billing, regulatory, all the quality measures, which are the right things to do, but without the voice and the usability lens of nursing,
Yeah.
so that it's pragmatic, it's usable, it's realistic, and it's simple, and it's safe.
Right.
It's tough to introduce new innovations in the
Right.
workplace. Because
Yeah.
again, just like change theory, if you can't prove to me that what you're wanting to change is better
Right.
than what I'm doing today, then it's
Yes.
probably not going to go, right?
And I
So
think
yeah,
especially with nurses,
that's
there's
right,
so much
that's
of
right.
that routine. I'm just thinking to the nurses on units that I've worked, that it's like built into their morning. You see your patients, then you go back to the desk away from them, you get your coffee, you get your
That's right,
whatever. I
that's
mean, that's
right.
their whole ritual of charting.
That's
And
it.
to
That's
say like,
it.
now we're going to do voice enabled charting in real time, isn't that great? They're thinking like,
Yeah.
when am I going to drink my hot cup of coffee?
That's right.
Like,
That's
yeah,
right.
it's wonderful.
That's
It's
right.
those
That's
little
right.
things that you're right. You have to tip the scale into really getting them to buy into that. It'll make it better. We promise.
That's right. Well, and
Have a
then
whole
and as a leader and, as an educator, unless you're at the bedside with them and really engaged in observing the pain points, right? Because
Right.
oftentimes I always say that technology and innovation, in our experience has so far been a solution looking for a problem.
Yeah.
And so
Interesting.
it's like
Yep.
here we have these bells and whistles, and
Right.
it's sort of like, well, I really didn't need that. I'm still struggling with this,
Right.
which you haven't addressed. And
Yeah.
so no wonder the adoption rates,
Yeah.
and it's challenging
So
to roll
true.
anything out because A, you haven't listened to what they need,
Right.
and B, you're trying to sell them something that's totally unrelated to what they
Right.
need and adds more work. And
I
so
still
it's
have this
like,
other
hey, how do you
problem.
think
Yeah.
that's gonna go?
Yeah. That's so true.
Surprise!
Yep. Absolutely. I mean, human behavior is its own obstacle. I
That's
think.
right. And when you look at, our technology industry, especially healthcare technology, they're starting to get smarter by having nurses be part of their marketing and sales and design
Yeah.
teams, because then that's the currency for coming
Right.
into a nursing environment to say, hey, invented by a nurse, or,
Right.
here's our nurse who
True.
will explain exactly why this
Yeah.
is valuable. So in terms of careers,
Yeah.
whether it's Amazon Health, Apple Health, Google Health, a
Right.
lot of these industries that are jumping into the healthcare game, don't be
Right.
surprised to see more and more nursing positions.
Yeah.
And so what does that do to our workforce in terms of
Right.
competing for these new generations of nurses? I mean,
Yeah.
would they rather work in med surge or
Right.
ICU, or the cool Apple building where
Yeah.
they can
Right.
design, you know what I mean? And so
Naps are built in.
yes,
Yeah.
yes.
I know. I mean, that's a good point. It's a valid point. But it's also that is I never thought of that as like a market, like nurses as products,
Yeah.
marketing to people, and yeah, it's an interesting concept. But it's true. You need that validity because I think nurses have this assumption that so many decisions are made on floors many, many levels above where they're
That's
working,
right.
and so
That's
there's
right.
automatically this like abrasiveness that they have to change on just that level.
That's
Um,
it, Brianna. And
but
and we're,
yeah,
I mean, year after year, we're the most trusted profession, right?
true. Yeah.
And who would you put on a late night commercial but someone you trust,
Yeah.
probably, to
Right.
sell something, right? Or,
Yeah.
because nurses are the most trusted, it's these industries are starting to pick up on how they
Yeah.
can leverage that in the
Absolutely.
consumer market, whether it's health
Absolutely.
plans, technologies, pills, I
Yeah.
mean, nurses are being asked to support and endorse
Right.
a lot of stuff now. So
Yeah. It
yeah,
reminds me of those commercials like, we asked 9 out of 10 doctors who would
right.
recommend da 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 da
That's
da.
right.
But now it's like your
They
nurse.
must be doctors because they're wearing lab coats and look
Right.
really, and the
Yeah.
stethoscope's backwards. But yeah,
Yeah.
kind of weird.
Now let me ask you about you mentioned a few times in the first it's about how you were in the right place at the right time for nursing careers and opportunities that came along. If you're a nurse listening to this and you feel like I haven't had that experience yet, how do you position yourself to be open to leadership opportunities or seek leadership opportunities if you don't feel like they're coming your way?
Yeah, no, and I think, one of the things is that with the vast amount of networking platforms now between LinkedIn,
Yeah.
social media, different professional organizations and their platforms to do that sort of, networking and connection. Now we're doing a lot more virtual conferences because
Mhm.
of COVID and the social distancing aspects of the pandemic. I think, one of the things I always tell my students and people that I mentor, Brianna, is don't wait for it to come to you. You have
Yeah.
to actively be out there and really, have your own elevator speech. What are you passionate about? What are you looking for? What do you enjoy doing? One of
Yeah.
my first charge nurses, Patrick, he said, Rayne, if you're no longer laughing and having fun, and it's time to move on. And so it's sort of like, don't wait till that moment. If you feel
Mhm.
like, gosh, I'm really passionate about something, or I'm really interested in that,
Mhm.
seek out. I mean, that's the beauty about the internet, social media, social, all of these networks, is you can put yourself out there, and millions, globally will see what you're about
Yeah.
and what you
Right.
like, and you'll make connections, and it's that snowball effect of who
Yeah.
else can I talk to, or who have you learned from, and maybe I can talk to them, and
Right.
learn from them. And believe it or not, I mean, a lot of these people, I always laugh because it's like, wow, you see authors and you see a lot of these quote unquote famous people, but they are just like regular people. You reach out to them, and don't be surprised if they talk to you like a regular person, and share
Yeah.
their story,
Yeah.
because I'm sure on their level, it's nice to feel normal, like a normal
Right.
person, and not
Yeah.
not be
Right.
surrounded by paparazzi, or be surrounded
Sure.
by, minders, and a lot of these barriers to just having that conversation. Because
Hmm.
oftentimes it's nice, to be able to see how someone's journey took them to where they are, in order to look at your own journey and say, wow, I didn't even think about that, or gosh, and we all meet people every day. And for me, it's like, whenever I say Rolodex, you can
Hmm.
tell who's young and who's not, because some people will say, heck, the Rolodex.
Right.
And so
Funny.
I keep this
Yep.
Rolodex of
Yep.
mentors and just people and different, adventures that
Yeah.
I've been, blessed to be a part of. And as things come up, it's like, oh, let me introduce you to my friend. And
Yeah.
then, whether it's an email, a LinkedIn message, a text message,
Right.
a FaceTime, and then you just kind of get the ball rolling, and then
Yeah.
you've just started a new partnership, or a new, and then, it's
Right.
awesome to see great things happen from those opportunities. But, to me, it's like you become this sort of switchboard,
Right.
person,
Yeah. That's a good
at the end of the
analogy.
day,
Yeah.
and that's the
Absolutely.
beauty about, my adventures, Brianna, is you get to work in so many different places. You get connected to, awesome leaders and mentors who
Right.
connect you with others who have the same passions and
Yep.
goals, and you just make beautiful things happen from
Right.
there.
And I feel like a lot of nurses that are very accomplished, a lot of their stories start with, I never thought I was going to be involved in this. And
Yeah,
I think a trait they all share is really being open minded and just curious,
that's
and
it.
being willing to follow that path for however long it holds your interests and engages you. And if it turns out to be a dead end, like you pivot back,
That's it.
So
That's it. But you always learn something. You always learn
absolutely.
something, and somebody else has a
Absolutely.
question that it's like, oh, I don't know that answer, but I know someone who does. Or,
Yeah. Right, exactly.
and
Yeah,
you're always
that's the
helping
nursing
someone.
line.
That's it. That's
Yeah,
it.
so true.
Yeah.
Tell me, as a nursing leader, either specifically in your role or more generically, what has been a great challenge for you, either currently, in the past?
Yeah, I think, one of the things about, there's so much to learn, and so many things that we can do to either do something positive or transform or change something. That there's we always say there's not enough time in a day, but I
Mm,
think, along with trying to balance time, whether it's our calendar or schedules, whatever, it's trying to balance your energy. Because I think,
yeah,
you know oftentimes even too much of a good thing could lead to burnout.
yeah,
And, often, what I learned in my early career is that you get sort of addicted to work. You get
yeah.
addicted to doing stuff and fixing stuff, and
Mhm.
being a nurse and being a nurse leader, and that you
Yeah,
never leave, that you're just there. And, next thing you know, it's the sun's going down, and you haven't worked
right,
out. You haven't spent time
right.
with your friends or family, and you go home and you're just talking about work, and it's like, oh, and so I think for me, it's learning to, just continually, we talk about the balance, but I think it's, for me, it's just continuing to balance that energy, time. And if we haven't learned anything from this pandemic, it's be with the ones you love while you
Yeah,
can, and
absolutely.
if, and that's at the end of the day going to be your reputation and your legacy. Because, there's always going to be an opportunity to improve something, and, whether it's at work or in
Yeah,
life. And at the end of the day, it's, for me, having 3 little kids, I want to be the dad that was there, when it
yeah,
mattered, and be remembered. That's, to me, only legacy that matters at
yeah,
this point, in my
absolutely.
career. And so, yeah, I think those are the challenges every day. And again, balancing emotions as well.
Yeah.
knowing that, when you look at your calendar, wow, that's going to be a hard meeting, or that's going to
Yeah.
be a challenging one. And as leaders, we have to agree to disagree, and
Hmm.
that's it. One of my mentors always told me, Rayne, in approaching a tough situation or a big project or launching a big program, there's three things I want you to remember. You always have to approach it with humility, with curiosity,
Hmm.
and with respect. And so you always respect,
Good
why
point.
things are the way they are, and how they got to be where they are, and put away those biases, and really listen first. And then humility in that, man, this is an opportunity of a lifetime. It's like, gosh,
Yeah.
to be part of this team, to be part of
Right.
this work, to be in this career, this
Yeah.
profession. We have lines of people wanting to come into nursing, much less
Yeah.
work in the fields that we do. And so
Right.
never
Right.
forget, where we've come from, and that it's an
Hmm.
honor and a blessing to be in it. And then
Hmm.
just, curiosity, always
Hmm.
ask why, how,
Hmm.
what else,
Right.
and really be open to different perspectives, because disagreements and, differing opinions, that's normal. I'd be more scared if people always
Right.
agreed or just didn't say anything.
Yeah.
That's worse than someone saying, let's think about it this way,
Yeah.
or maybe we can do it this way. Or I don't really agree with that. And
Right.
it's like, well, let's have a conversation, because I don't
Yeah.
know everything. I'd love to learn,
Right.
from your perspective, or your lens. And so, patients nowadays are coming in asking you about diagnoses, about, drugs, about, lab
Hmm.
results, because they're seeing it before you ever get a chance to look into their
Right.
chart half the time,
Uh-huh.
Brianna. And that's the
Yep.
world we live in,
Yep.
today. And so
I know. I was
there's
surprised when
two.
I got access to my own labs the other. I'm like, ooh.
You know what I mean? And so there's two reactions to that. There's the defensive, oh wait, what do you mean? I'm the expert, I'm the clinician here.
Hmm.
Or, oh, let's have a conversation. Let's
Right.
talk about that, because now you're engaged in your care,
Right.
and we can actually, talk about interventions and what to do
Sure.
about it. And so, yeah.
Yep. Yeah, that is a very good point. You touched on one thing about disagreements with coworkers or other
Yeah.
leaders in your field. I think especially people that are at your level or maybe above you. How do you handle specifically disagreements?
Again, going back to the curiosity, humility, and respect, I think, again, realizing that everyone comes from a different journey, a different
Right.
lens. Even as we tout, interdisciplinary work, everyone comes at, an issue from their profession, from their expertise, from their experiences. And so I think, for me, disagreements often has sort of a negative connotation, but
Right.
in reality, it's just really differences, and
Right.
understanding those differences, and then building something that meets,
Right.
as many of the needs as possible, knowing that, the enemy of good is always perfect. We
Yeah.
always try to
Right.
be perfect. We won't pilot something unless it's perfect. We
Yeah.
won't try something new unless it's perfect. But that's
Hmm.
sort of the antithesis of why we do rapid improvement testing and
Yeah.
piloting and innovation, right? And so I think, for me, disagreements are going to be natural. In fact, get that out there from the
Yes.
beginning,
Right.
that that's
Expect them.
normal. In
Yeah.
fact, if we don't disagree, there's something wrong, because I know
Right.
you have a different experience than I do, and that's
Yeah.
totally
Yeah.
cool. And it's how to have those respectful conversations.
Right.
There's, oftentimes there are people who sometimes listen to react versus listen to
Yeah.
understand. And
Right.
that's very disturbing, in terms of, gosh, are we going to actually do something together here, or are you just going to disagree
Right.
for the sake of
Yeah.
disagreeing, and then, coming to those terms in the beginning. So I think, being professionals, and knowing that we're all in this together.
Right.
I work in a union environment, and oftentimes,
Yeah.
unions are villainized,
Yeah.
or management's villainized. And it's sort of like, being in our country, we have different political parties, different
Hmm.
religions, different, backgrounds, different
Hmm.
cultures. It's the same thing with union management. To me, it's all part of our industry. It's all part of,
Hmm.
our world in healthcare.
Yeah.
And it isn't one against the other, as much as understanding where both are coming from, and
Right.
coming to an agreement and how we move forward. Because what I've learned, being on both sides, Brianna, is that we're all in this for the patient.
Right.
Because again, we're all going to be on that gurney or on that bed one day,
Right.
and wouldn't we want the best for ourselves and our
Right.
family members and those we love? And so
Yeah.
however we come at that, we just got to, understand each other, and it's okay
Yeah.
to disagree, at some points, but then,
Right.
let's talk about it, right?
Yeah. No, I mean,
So
it doesn't have to be more complicated than that. I like
that's
it.
it. That's it.
Um, Tell us how you manage. You're a very busy person, I assume. How do you manage your busy workload? You mentioned briefly, using your commute to your advantage to kind of create that buffer zone between work and home. What other tips or tricks do you have for people that are super busy? Which I
Oh my
know
goodness.
wears a badge of honor, which I personally dislike. But
Yeah, and one of the things that I've learned, Brianna, is that, with virtual meetings, they, often they're better when they're shorter, because unlike being in person where you get to connect and talk and, body language, etc. When you're in virtual meetings, oftentimes it's like once you, meet and get what you need done, don't hang in there and hope that, something else you might want to talk about something else, because again, time is of the essence. We're in this point where we're bouncing from one meeting to the next, oftentimes overlapping.
mhm,
And so if we can, be purposeful about the agenda,
right,
about getting things done, and then set up, either follow-up meetings or let's connect and talk about how it's going later on, and really using technology to
yeah,
our advantage in terms of being able to say, yeah, I'll be driving, but let's have a conversation,
right,
and so get those things over with so we can get our day started,
right,
versus waiting until I get to the office or
yeah,
waiting till 8 o'clock or 9 o'clock, because oftentimes we're having coffee, I can have a 10-minute 15-minute
right,
conversation to talk about the plan, and let's go,
right.
let's make this
Yep,
happen,
you good? I'm
and
good. Yeah,
yeah,
right,
yeah, and it doesn't have to be that traditional
right.
view of what meetings are. One of my favorite books, is Death by Meeting, and it talks about the different kinds of meetings that you should
Yeah,
have, and I think they should come up with a new chapter called virtual meetings,
right.
and to
So
talk about
true.
the appropriateness of how long a virtual meeting, much less
Right.
a virtual class,
Yeah,
should be, because between the distractions, like you mentioned,
right.
having the kids and
Yeah,
just everything around us, just realize that our attention is only here for a
right.
certain amount of time.
Yeah,
And so really, if you look at an agenda and it's like, yeah, nothing's really changed, or I don't really have anything new to say,
right,
deciding what could be just an email or a text message
right.
versus an actual meeting, and
Yeah.
then just go call it from there, and that'll be okay,
To the
because there's
relief
no
of
such.
everybody that is
Yes, yes,
supposed to be in
totally.
attendance. Yes.
Totally. Again, we're in a place where we're so burnt out and overloaded right now that anything we can do to have grace and just, free up time
Mhm.
throughout the day, but still get things done. My boss and I were having a conversation, our chief nurse, and we're all about outcomes. I don't care how you get to that outcome, but just get to that outcome,
Right.
because we realize, again, to your point, you're busy, life happens, but if we're all focused on getting to that outcome, so we have
Yeah.
quality, safe, affordable patient care, great, and we'll check in as needed, but
Mhm.
we don't have to micromanage every step of the way and have meetings to make sure in the meeting after the meeting that, we need to move away from that, because it's
Right.
it's such a waste. Yeah.
Yeah. Yeah. It's very true. Um, Tell me about the future of nursing, which I know is a big subject, but future changes. What do you foresee happening for nurses, nursing, nursing education, whatever part of that you have your crystal ball tuned into? tell
Oh
us,
my
tell us what
God.
it shows.
Yeah, I think the future is bright, and I think, again, as we look at the future of nursing when it comes to, working in various specialties or learning more, it's like we letting go of a lot of the traditions in terms of earning our stripes or earning,
Yeah,
the right to go into another specialty or to, climb the career ladder, of leadership, and, and giving, I think, nurses opportunities to get a not just a peek into those opportunities or those worlds, but experience and
Yeah.
exposure into those worlds if they show an interest. And I think leadership, as leaders, we need to be, I co-wrote a chapter in a book recently about appreciative leadership. And
Yeah.
so, how as leaders do we stay attuned to those who are wanting to know more, wanting
Yeah.
to
Right.
learn more? And it's okay, because in today's generations of nurses, they're not looking to have a 30-year career and then retire. It's like, let me try this out. A couple of years, great.
Hmm.
Move on to the next thing, and try that
Hmm.
out or progress to the, next level
Right.
or whatever. And just realizing that that's the world we live in,
Yeah.
which is
Very
okay.
true.
And so it puts a lot of the onus on us to continue to have these training programs and residencies, so we aren't having huge gaps in employment or specialties, but we have a constant state of refilling
Yeah.
our workforce. And again, people finding the right match when it comes to specialty
Right.
level role, and really sharing how everything connects. It's like,
Yes.
but where do you want to be at this time in your
Yeah.
career, and making that to be okay. And so,
Right.
a huge thing, in terms of the future is the partnerships between academia, the community, again, technology, and
Hmm.
our employer groups when it comes to nursing, and seeing that nursing is not just a United States issue, but it's a global
Hmm.
issue, that we can't continue to sort of pillage each other's countries for nurses, but how do
Yeah.
we support each other maybe globally,
Right.
through education, through innovation, through technology,
Yep.
and again, build a wider net and a wider community of
Yeah.
nurses, so we're
Yeah.
learning from each other. A lot of the focus, and when you read the Future of Nursing report for the next 10 years, it's all about equity, inclusion, and diversity.
Hmm.
And so to me, that again, that's local, but that's also global.
Right.
And so how do we, and it's pandemic, it's a global pandemic, it's not a Hawaii
Everybody
or
put together,
California.
but states
That's
6 feet
right.
apart.
That's right. And so how do we solve problems globally? So
Hmm.
if anything like this hits again, God forbid, that we're all ready and we're all on the same page
Right.
together, and supporting each other. And so that's to me the future, in terms
Yeah.
of breaking down a lot of the silos, both within our practice, but within the whole global community of health and healthcare at large,
Yeah.
Brianna. So exciting times.
Yeah. Well, tell me, you mentioned it actually, perfect segue into our final question, which is how do you personally handle COVID crisis, any type of, I mean, I'm sure, I shouldn't say I'm sure, but hopefully we get a breathing space
Yeah,
before the next crisis hits, but they're inevitable,
right.
especially like with the globalization of nursing. How do you handle crisis situations as a nursing leader?
Yeah, well, I think that's where I'm blessed starting out in the emergency department, because, that's what we trained for,
Yes.
in terms of crises, whether it's, a disaster in the community or a disaster in the
Yeah.
hospital. And so, I carry a lot of those lessons even in
Right.
today's, work, in terms of, again, I reflect back on my mentors and charge nurses in my early career, Brianna, who said, know when to run. Don't
Hmm.
be the guy that's freaking out, because especially if you're the leader, no
Yeah.
one wants to see the ship captain that's, has a life vest and ready to jump off the
Yeah.
ship.
Right.
You want to be the one that calms the waters. You want to,
Hmm.
get yourself calm and resilient, and realize the situation and know what to do next,
Hmm.
and have the team all, on the same page and communicate. And so to me, I carry a lot of those tenets and
Yeah.
lessons from the
Same.
emergency department, into my work today. And honestly, that's how I manage and just mentally prepare for any of these crises,
Yeah.
because you have to be, a calm, it's sort of that, the eye of the storm. You have
Right.
this storm around you, but the middle of it is very calm, very serene, very peaceful. And so
Hmm.
that's sort of my
That is
mindset
true. Those
as
are the
things
ones
are
you want working
swirling
with you.
around you. Yeah,
Yeah.
yeah, yeah. And just realizing that, people are looking at you in terms of your tone, your reactions, your
Right.
communication. And so being very, again, check in with your team, check in with people,
Yeah.
and make sure that they have enough of information to know what to do with it, but
Right.
not so much information that now it's a rumor mill, or it's a,
Yeah.
swirl of anecdotes and
Hmm.
non unfounded,
Right.
things. And so be very controlled about, communications, and be encouraging, and again, find ways to celebrate as you get through those,
Right.
next steps, or
Yeah.
that you're making it, and coming back, fighting again another day. Man, those are
Right.
huge nowadays, Brianna.
Yeah.
So
No, it's so true. It's very, very true. I definitely can relate to what you're saying in terms of like the ED background. And I remember I had a
yes,
great, she wasn't my preceptor, but veteran nurse in the ER, who would always say the details are always going to change, but the methods stay the same.
that's
Like
right.
you come in, you stabilize, and then you move on,
That's exactly
It's
it.
only ever what you're going to do. And I remember like that was my mantra in the beginning when it
That's
just felt
exactly
like,
it.
how am I going to know all the things, and
Yeah,
do it
no,
quickly.
that's it. That's
Yeah,
it. And it's true, even with trauma, right? It's like
yeah,
a lot of people glorify the trauma, situation, or a trauma,
right,
scenario. But to your point, it's a very controlled,
right.
it's step one, all the way, and you have to,
Yeah,
otherwise people get hurt, and
right,
and you have to, and that's like, to your point, you carry that into any of these disaster or
exactly,
crisis situations. Yeah.
exactly. Well, this has been amazing. Thank you for just sharing with us about. I love your enthusiasm for new nurses coming in. I think we
Yes.
need that. We need their energy. We need their hopefulness and optimism, not to crush their little nursey spirits,
That's right. That's
because
right.
yeah, we need that infusion
That's right.
into people that are just so depleted beyond. Um, so I love that there's people like you out there that
Oh,
are
thank
holding them
you.
up and ushering them in under your wing and getting them interested in all the different ways that you can be a nurse today.
That's right.
Um,
That's right.
is there? I'd love to give you the opportunity if there's anything else you'd like to speak about, or yeah,
I think,
or
lastly for me, Brianna, is, often when I talk to colleagues or even new nurses, you hear things like, I'm just a nurse, or I'm
yeah,
just the nurse, right?
right,
Or, oh, I'm just going into nursing. Or, oh, nursing for now. But man, with our
yeah,
history and the fact that I think nurses, I always was taught hospitals wouldn't exist unless nursing existed.
hmm,
When you think about the power of nursing,
right,
we're the most trusted profession. We're often the heart of anything that's happening, whether it's innovation, transformation. We're the heart and, the soul, I would say,
yeah,
of healthcare. And
yeah.
there's a lot of power to that. And so for
Mhm.
all nurses out there and those thinking about or wanting to come into nursing, just realize that there's a lot of pride
Yeah.
and a lot of power in being a nurse. And
Yes.
so next time you feel yourself saying, I'm just a nurse, or feeling like, oh, I'm just a nurse, just know the power you have, and the
Yeah.
power, no matter what role, what department, whatever
Right.
specialty, when you have that, license, and when you have that as a nurse, you have the power to change any
Yeah.
situation and be the heart of that change moving
Yeah.
forward, and never squander that, or lose sight of that.